Let's turn now to the coronavirus pandemic. The case count of coronavirus cases has now soared to more than 19.1 million cases in the United States, while the death toll has risen to more than 333,000. And holiday travel is only going to contribute to the surge. Let's bring on Dr. Jennifer Cowart, internal medicine physician, now to ask her some more questions about this pandemic. So, Doctor, I'm wondering what you're seeing as you're working, how the holidays, Thanksgiving, we most recently had Christmas, have been contributing to some of these case counts that we've seen continuously rise day after day.
Thank you. So we're definitely seeing people who have contracted COVID-19 from either family gatherings or going to church. Typically, people are getting it from people they trust, people they know and love, their families, their friends, people who you thought were safe. And then, unfortunately, coronavirus comes anytime that people are gathering together. So where I do expect that after people were together for the holidays and maybe together around New Year's holidays, that we will see coronavirus cases continue to rise, really unfortunately. So I would just ask that everybody really double down on wearing their masks right now. I liken it to if you've been on a diet and maybe you had a meal that was a bit more than you expected, it kind of broke your diet a little bit. It's easy to feel like, well, I'll just let the whole thing go because why bother? I've already broken the diet. But now it's really time to buckle down and get back on our program of masks and limiting those indoor gatherings, especially only masks at indoor gatherings. If you must gather, please gather outside, weather permitting, because coronavirus is coming home from Christmas. Coronavirus is in a lot of our homes right now, and it will spread from home to home if we're not really extra careful now with the masks and limiting those indoor gatherings.
And speaking about that, because I know that I'm not the only person out there who has felt, hey, my brother, my mom, they're safe. They're my family. I think of them as part of my household, even if they're not actually a part of the household that I'm in right now. So really, going forward, is it just as simple as if you do not live with these people, then you really should not be seeing them, and definitely not inside, and especially not inside and without a mask?
Absolutely. I think of it in levels of risk. If they don't live with you, then they're doing their thing in their circle. You're doing your thing in your circle. You're bringing all of your combined risks together. So if they don't live with you, you really need to be wearing a mask around anybody that doesn't live in your house. And if at all possible, again, weather permitting, gather outdoors. If you must be indoors, limit the size of the gathering and wear a mask inside.
Now, we hear that President-elect Biden, that after he takes office, he might actually invoke the Defense Production Act to increase the supply of the vaccine. How necessary is that right now? We do see vaccinations are ongoing. We're seeing doctors like yourself receiving the vaccine and being able to receive that vaccine. But how necessary is it, do you see, over the next couple of months, especially in these critical winter months, that we really start to ramp up production of the vaccine?
Absolutely. Very critical that we ramp up production as fast as possible. We have the 2 vaccines right now under emergency use authorization, the Pfizer and Moderna vaccines, and just the sheer logistics of getting that vaccine, the syringes, the needles, alcohol wipes, everything that you need to administer that vaccine, and the cold storage to keep that vaccine safe during transit and during storage. Getting all of those things up and running as fast as possible is going to take resources. So I think getting the DPA on board to get that vaccine up as fast as possible is going to be really, really crucial.
I have just about a minute with you here, Doctor. I want to know, just as a reminder for everyone, really, how challenging as you see it, and as your fellow, frontline workers, doctors, nurses, etc., are seeing how challenging the next few months are going to be. What are you anticipating?
I'm anticipating more of what we're seeing right now, which is rising cases, also rising fatigue, with the social distancing, with people not being able to see their loved ones. So I would just urge everyone not to think of it as all or nothing. It's not a binary. It's not you wear a mask and you never, ever, ever see anyone, or you wear no masks and you just live, doing your life as you would have before with large indoor gatherings and seeing everyone without wearing a mask. There really are ways to try to see your friends and family and have those benefits of social interaction, either virtually or outdoors or very small groups, always with masks on, to try to limit the risk of not having social interaction, the depression, the fatigue, the burnout, but also none of us want to be the one that spreads coronavirus to our loved ones. And so what I'm seeing now, again, are families that come to the hospital who all have coronavirus. They all got it together. And so we want to protect those vulnerable families. So always, always wear your mask. Like you said earlier, if you're going to see somebody who doesn't live with you, please wear a mask when you see those people, because we all have to assume at this point, I think, that everyone around us may have coronavirus. And I think that's going to be true for several months more while we're waiting for the vaccine to be produced, while we're waiting for it to be distributed and administered to as many people as possible. And then remember, it's a 2-shot series, so it does take some more time. Once you get the first shot, you have to get the second shot, and then it's at least another week after that second shot before immunity is really at its peak. So we're still in this for several months.
All right. Well, sharing definitely not caring throughout this holiday season. Dr. Jennifer Cowart, internal medicine physician, thank you so much for bringing us all of those very important reminders as we have the New Year holiday to look forward to.